In our AI Monday newsroom crossing, cancer is the second largest cause of death worldwide. This despite various technological breakthroughs. And with October being Breast Cancer Awareness Month, we ask whether artificial intelligence advancements can solve the long-standing curse of the disease. Johan Steyn, AI and automation thought leader, who is also a Business Day contributor, joins us with some insight. Thank you so much for your time, Johan. Now, artificial intelligence is being used to change the landscape of different industries for the better. Is AI playing a significant role in healthcare yet?
It is. It's still somewhat limited. It's definitely not democratized. There's only the rich countries that can afford it. It comes to finding patterns in your data, whether it's your breast scan, your lung scan, your prostate scan, or a number of other potential diseases. These algorithms will never replace doctors, but it can absolutely help doctors to diagnose and treat sicknesses. But, in our hospitals, in our country, especially our public hospitals, we still have people lying on the ground. We don't have space for them. There's some dire circumstances. So AI is a bit of one day we will get there, but I do think if we do something in Africa and South Africa, it can help us. The use cases are there. It is not theoretical. We can absolutely do it, but it takes willpower, it takes the government, it takes private sector, and it takes money. And that's where the problems lie.
Well, I mean, Johan, you talk about, AI being able to collect all this data, all these algorithms to come up with, certain conclusions. I mean, where in the ecosystem of, cancer detection and treatment would AI be best placed to make a difference?
Yeah. So remember, a doctor with 20 or 30 or 40 years of experience will already be able to look at a scan, whether it's a mammogram scan or others, and fairly accurately, based on his or her experience, make an assessment and a diagnosis. But if you compare that scan with 100,000 or even 100 million other scans through computer vision, through machine learning, the chance of picking up problems that even a very experienced doctor might not see really increases. So that it's in this whole conversation, one of the keys for me is early detection.
Yeah.
Because if we detect something like cancer early on, the survival chances are so much better. The problem we have in much of the developing world is we don't have the mammography equipment and other medical equipment to pick up these cancerous problems and tumors early on. It's only when people start feeling ill and start feeling sick, then they go to the doctor and it's already almost too late. But so computer vision, assessing scans, also looking at your own particular medical history, the nuances of your family. Is there a proclivity of heart disease, of certain types of cancer, and to use all of that data and to build a model to predict, but not just to predict, but also to build a personalized treatment plan. And this is what really is sad for me, that this technology is there. It's being used all over the world. Is it a cure for cancer in Africa that will triple by 2024? Or sorry, by 2040? Absolutely. Again, government, business, willpower, and money. It is there. It's not in the realm of the one day we wish it will happen. We can do it right now and save thousands of lives.
It's quite interesting that you talk about, the fact that not enough money is being funneled into this area. And it's quite interesting to me because are we also shooting ourselves in the foot that because there isn't a lot of capital going in there, that medical care for cancer will still remain, and just medical care in general will still remain expensive, particularly for a continent like Africa that is still struggling economically?
Yeah, absolutely. I was in Cape Town last week and I spoke with somebody who works at Groote Schuur Hospital, one of the best hospitals in our continent. And she told me about these pieces of equipment that costs millions of rands for prostate cancer in particular. I think they procured 4 or 5 of them, I speak under correction, but most of those pieces of equipment are not used because people have not been trained. They don't know how to service it. They can save thousands of lives. And the other thing I would like to say is, and this is not about being into conspiracy theories, but cancer is one of your biggest money-making businesses in the world. You know, in this article in Business Day tomorrow, I speak about my own mother and her mother who died in the same week in the same oncology ward a decade ago. And I remember a decade ago, my mother's cancer treatment was 70,000 Rand a month. And this leads me to wonder. Look, firstly, I know hospitals needs to keep their beds filled. It's a business model, I understand it. But it also brings me to big pharma. It's such a big money-making business. Even if the technology exists to eradicate cancer, will big pharma and big capital allow it to happen? The technology is there. The money we can get if we are smart, but people make so much money through cancer treatment that, you know, why make it better if we can keep on milking this cow?
Johan, I know that you say that AI cannot replace doctors, but could it help in maybe reducing some of the gaps that we have in the skill shortage on the continent?
Absolutely. Look, we definitely have a medical skills shortage amongst many others. But if we use technology right, even if you're not a qualified doctor, but you're a nurse or a healthcare practitioner, and you have the right kind of equipment that uses AI and machine learning and prediction to work with patients, even if it's in palliative care toward the end, if we think of hospice, then let's take the kind of the burden away from the very specialized doctors that are in such shortage, and use technology and equipment and handheld scanners and the like to actually get nurses and other medical practitioners, especially in our rural areas, to help to early detect this disease. You know, I know somebody, she's wonderful, Catherine Malherbe, who is a breast cancer researcher at the University of Pretoria. And she also has a non-profit. They actually have developed a handheld scanner, and they go into the rural areas, and with that scanner, they can do a breast scan, connect it to their cell phone, connect it to the cloud, and connect it to hundreds of thousands of images. And in that simple way, already can predict whether there's a problem and prescribe treatment, because those people will never get to a mammography equipment and qualified doctors. So this is the dichotomy for me. It's the potential is there already, but most people are dying from cancer because they never get treated. And if I can just add this, if I remember correctly what Catherine told me, and this is now 3 years ago, the worldwide statistics for breast cancer is about 1 in 8. So 1 out of 8 women will probably get breast cancer. In Africa and South Africa, if I remember correctly, it's about 1 out of 3.
Ooh.
So it's a scourge. It's one of the silent killers. Technology is there, and we have to, as a collective, do more to save lives, because the technology is there already.
Well, thank you so much for your time and giving us insights on this very, very crucial conversation, and really what we could do to better the situation. Also looking forward to combing through your article that comes out tomorrow, Johan. That was Johan Steyn, AI and automation thought leader, who's also a Business Day contributor.